Okay, perfect. Alrighty, so hello everyone. Thank you for joining us for tonight's update. My name is Stephanie, I'm the Communication Specialist. Hola a todos, gracias por acompañarnos hoy en nuestra actualización. La próxima semana, el martes, sería el 29 de junio, vamos a tener nuestra actualización en español. So we are continuing our vaccination efforts here in Yakima County, and I'll just provide at the beginning a few more information updates on the vaccine site, the mobile units, as well as sharing the COVID-19 dashboard to provide more information on how we're doing in terms of vaccination. And this evening, we also have Dr. Larry Yeka, our interim health officer at the Yakima Health District, who will be able to talk to us more about the vaccines, the importance of getting vaccinated, and also tips for our mental health during the pandemic. So if you have any questions related to COVID-19 or the vaccine, please go ahead and leave them in the comment section as I will be monitoring it on Facebook. And if you have any other questions, please go ahead and leave those there as well. We can try to answer those during this update or a different one as well. So to begin, I am going to share my screen here so we can go ahead and have a look at the COVID-19 dashboard, and I'll share how we're doing as a state as well as how we're doing as a county in terms of vaccination. Perfect, and I think everyone can see my screen here. So this is the Department of Health COVID-19 dashboard. So looks like this was last updated today. And in terms of vaccination, as a state, we are 67.8% of individuals 16 and older who have initiated vaccination. So we are very close to that 70% needed in order to open up sooner than June 30th. So we are still seeing individuals get vaccinated, and we encourage all those who haven't done so already to take advantage of all those vaccine opportunities that are happening throughout our community. But we're doing a great job. And just a reminder, if you received your Moderna or the Pfizer vaccine, those do require 2 doses. So please mark your calendars for your second dose. And there's lots of opportunities for that as well. And as a county of individuals who are 16 and older, 56.9% have initiated vaccination. And of individuals who are 16 and older, 50% have been fully vaccinated. So we want to continue seeing individuals in our community get vaccinated. We do want to see upwards of 70% of individuals get vaccinated here in Yakima County. And there's lots of great opportunities to get vaccinated. Thank you to all those who have been vaccinated. And I'm going to go ahead and share more information on where you can get your vaccine at the Community Vaccination Center, as well as the mobile units that are occurring throughout our community. So our yakimavaccines.org page. So if you go to yakimavaccines.org, it'll go ahead and take you to our COVID-19 vaccine page. And here there will be more information on our Community Vaccination Center. Our Community Vaccination Center at the State Fair Park now has new hours of operation. It's open on Sundays from 10 a.m. to 8 p.m. and it'll be open on Monday through Thursday from 10 a.m. to 6 p.m. And it'll be closed Friday and Saturday. So it'll still be open those 5 days a week. Lots of opportunities to get vaccinated, and no personal identification is required. No appointments are required. And if we scroll down a little bit below here you'll find a list of all the mobile locations, all the mobile unit vaccine locations that are happening throughout the community. There's lots of opportunities going from Union Gap to Sunnyside, Yakima, Granger, lots of opportunities to get vaccinated. Today, it looks like there was 3 mobile units. One is still occurring until 7 today. So those of you watching us, if you'd like to get vaccinated, we still have 1 more mobile unit for the day. And then tomorrow and throughout the rest of the week, there's lots of opportunities to get vaccinated. And as a reminder, this page will be updated every week to provide all the information on where our mobile units will be located throughout that week. There's lots of opportunities, so we encourage individuals who are hearing us, who are watching us, please share with those that you know are wanting to get vaccinated and still don't know where to. All of these locations are no appointments required. They're open to anyone 12 years and older, and it's just free, fast vaccination in our community. And again, our community vaccination center, new hours of operation, Sunday from 10 a.m. to 8 p.m. and Monday through Thursday from 10 a.m. to 6 p.m. Perfect. I'm going to go ahead and stop sharing, and I'm going to go ahead and check to see if we have any questions for the information I provided to you for the moment. Okay, it looks like we don't have any questions for now, but we can go ahead and get started. Thank you, Dr. Yeka, for being here tonight and providing us more information. We truly appreciate it. To begin here, as a state, as I showed earlier, we're close to reaching that 70% of individuals 16 years and older who have initiated vaccination. If we do reach this number before June 30th, we will be able to open up sooner, so that's great news. If we open up before June 30th or on June 30th, does that mean that this pandemic is over? Is our work done?
Well, no, the pandemic isn't over and our work isn't done. That just means that we've got enough people vaccinated that we feel that we won't be getting another surge. It doesn't mean we're not going to have people unvaccinated getting the disease, though. And so opening up will depend on what the governor's definition of opening up yet. We really haven't received that information now. So we'll wait and see what that means. But it doesn't mean the pandemic is completely over. We're still in fairly high numbers, running less than, it's really right around 100, but less than 100 per 100,000 for 2 weeks. So we still have a ways to go. The problem, everyone said, well, 70% is that herd immunity. The problem now we're seeing with the variant strain is that it isn't quite, it's playing havoc with our herd immunity because it's in the unvaccinated people, the variant strains are more infectious. So it's spreading quicker. So it's going to take more, really probably than 70% to end the pandemic. So we have a double-edged sword here with the variant strains kind of not helping us right now. So that's why it's so important is to get vaccinated so you're protected against the variant strains. But without that protection, you're going to see a lot more people being infected in the community that aren't vaccinated.
Thank you, Dr. Yeke. And we do know that the vaccines are safe and effective. They're available, accessible to our community. So please, we encourage you to take advantage of all those opportunities to get vaccinated and remain safe for yourself and for those around you as well, and try to continue to create that immunity for our community so we can continue to be protected and reduce the spread of COVID-19 in our community as well. Perfect. I'm going to check to see if we have any questions. For those that are watching us, we do encourage you to ask your questions, any concerns or questions you may have about the vaccine, COVID-19. We do have Dr. Yeka here who will be able to answer those questions for us tonight. Okay, so I'll go on with another question here. The Pfizer and Moderna vaccine each require 2 doses for maximum protection against COVID-19. Why is it important to follow that recommended time interval between the first and the second doses? And what is that recommended time interval in case some of the individuals watching us are not aware?
The interval is the safe time when the booster is at the maximum effectiveness. Many of the studies, they did timing of the first dose and second dose. And if you do it too soon, you don't get quite the antibody reaction that you should. So you need to wait that 14 days so you can get a better reaction. If you wait a little bit longer than 14 days, it really doesn't matter. That's not critical, but you don't want to get it before the 14 days.
Thank you, Dr. Yeka. And then just a reminder for those individuals who get your first dose, in your vaccine card, there will be a reminder of when you need to come back for your second dose if you receive that Moderna or the Pfizer, and the Johnson & Johnson is only a single dose. And you will be considered fully vaccinated 2 weeks after your second dose of the Moderna or the Pfizer vaccine, or 2 weeks after that single dose of the Johnson & Johnson vaccine. So lots of great benefits to being fully vaccinated. Individuals can safely engage in more activities and start to return to more of a normal life. Okay, thank you, Dr. Yeka. And no questions for now at the moment, so we'll continue on here. So we've heard lots of rumors in the community about the COVID-19 vaccines, and these can have definitely very negative impact on individuals' decisions to vaccinate. One rumor is about deaths. Have there been any deaths associated with the COVID-19 vaccines?
No, there have been deaths after vaccines, but there's been studies, even when the vaccine was made, there's always going to be deaths after some event. And they had more deaths after the injection of normal saline in the double-blind studies than they had in the actual vaccine. And CDC really hasn't had any deaths that were associated, attributable to the vaccine. As you know, whenever you have something, you're going to have deaths following it. Whether you eat a certain food or something, you're going to have deaths after. But unless it's related to that effect, it's not important. And that's what people have to realize. You know, people can say, oh, you can die from, well, you can die after anything. But it's just the statistical averages. But there hasn't been any associated with the vaccine. So it's very, very effective, very safe vaccine. And the other question, a lot of people say, well, why, if I had the disease, why do I need to get vaccinated again? And there's a couple of reasons. More of the research is coming in. One, it looks like the research that you have better antibody production after the vaccine than you do the actual disease. So that gives you better protection. There's also individuals that have had chronic problems from the disease. It really stimulates the immune system, and people are having sort of an autoimmune type illness with it, that are having the chronic problems with fatigue and other things. And they're finding that getting the vaccine is actually helping these individuals. So if you're in that type situation or not, it's just another important reason to get vaccinated.
Thank you, Dr. Yeka. And it is important to continue to follow those trusted sources of information. And do we have any updates as to when we will need another booster vaccine? Or are they
No,
still
in
doing
fact,
studies?
right now it's being very effective. We've had individuals now for a year that's had the vaccine, and they have strong antibodies to it. So we know it's going to be well over a year. We don't know how much longer, but one nice thing, the vaccine, it's easy to develop a booster shot for it. So we'll have plenty of time to know if and when we need one.
Perfect. Thank you, Dr. Yeka. Alrighty, so June, we were reading an article from the Department of Health's blog post, and June marks the 6 months since COVID-19 vaccines arrived in Washington state, and we've made significant progress in vaccination as a state and as a county, and there continues to be lots of opportunities to get vaccinated. Why should people still continue to get vaccinated if they have not done so already? What can we tell them?
Well, I think we already mentioned the variant strains are really taking over now, and we're having UK strains, the California strains, the India strains, the Delta strain, which everyone's working at. It's starting to increase in Yakima. So these strains are more effective, and even if you're young or anything, you have a better chance of even getting it if you're not vaccinated. So for that reason alone, and really even the young people, there are some young people that do have very severe illness with the COVID. So, and hospitalizations, we're seeing hospitalizations in the younger people now that more and more of the young people are getting infected. So it's for your safety and the safety of others.
Perfect. Thank you, Dr. Yeka. And it looks like, let me go ahead and check our Facebook to see if we have any other questions from the community. Again, for those watching us, it's a great opportunity to get your questions answered. Any questions you may have about the vaccine or COVID-19 related topics, we do have Dr. Yeka here. Okay, so we'll jump on over and kind of change topics a little. The effects of COVID-19 on individuals' mental health has been significant, and it does vary from person to person. What are some mental health tips that we can provide individuals for taking care of their mental health during this time?
That's very important. You know, we are really seeing, tragically, a lot of more mental health issues and behavior problems, and it's a new way of life. The isolation, not being able to socialize, not being able to go with our normal routines have really affected us. So, one, you need to take care of your body. It's important. Get enough sleep. Get physical activity. Stay fit. Eat healthy. Avoid tobacco and drugs. We know the drug abuse and smoking, everything has gone up during the COVID. Limit your screen time if you can, but take care of your mind too. That's important. Reduce the stress triggers. Keep your regular routines. Limit exposure to the news media. News media is a lot of sensation, and there's a lot of false news on the social media that really just upsets people more. There's no science behind it and everything. So limit that. Stay busy and focus on the positive thoughts and set priorities. And then connect with others. Make your connections. Work with others. Support your family members. And remember, it's important to not isolate yourself, to stay that way, and then get help if you need it. If you find out that you're really feeling down and everything, contact a friend, contact a minister or leader that you that an employee assistant program. Some people do, or your primary care provider, and let them know, and they can get you in the right direction, I think. And also, if you really have any suicidal ideation or thinking of hurting yourself, please contact your hotlines for that.
Thank you, Dr. Yeka. Lots of valuable information you provided. And it's important that we continue to take care of our mental health, our physical health, all of that is very important. And even with like our physical health or getting together with friends, and now that we're individuals who are considered to be fully vaccinated, you can gather with other fully vaccinated people safely. So that's also another benefit of being fully vaccinated. And for physical activity, you can schedule a routine with a neighbor, a family, or a friend to go out on a walk once a week or a few days out of the week to try to motivate each other too. And in terms of mental health, the Yakima Health District also has a great app as well that supports this too. And I'm going to go ahead and share my screen so individuals watching us can see more information on where they can access this app. And this app provides lots of tools that can help you control your anxiety, your stress, chronic pain, and many more things. It's available to anyone living or working in Yakima County, available to anyone 13 years and older. And it's also available in English and in Spanish. So it's also another great resource for individuals too, as we're learning to take care of our mental health as well as restoring our mental health during this pandemic. Let me go ahead and share my screen here. Okay, perfect. I think we can see it. So this is our Yakima Health District main page. And here we'll have more information on the My Strength app. And again, Here, if we go ahead and click on it, it'll tell you exactly where we can sign up at the mystrength.com. And then there's also an access code, which is going to be Yakima County. And again, this is a free app available to all individuals who live or work in Yakima County. Using this access code, we encourage you all to use it. There's lots of great tools on there that'll help you with, again, stress, anxiety, chronic pain, and other things as well. They have inspirational quotes on there, and it is available for you to use on your phone, your tablet, your computer, wherever you will like to use it. And again, it's free. So that's another resource, and it's available on our Yakima Health District page for those that are watching and would like to get more information on it there. Perfect. Alrighty. And I'm going to go ahead to see if we have any questions from the audience who are watching us tonight. Okay. Okay, so it looks like we don't have any other questions at the moment. Dr. Yaka, did you have anything else you'd like to add before we end our update for tonight?
No, I just like to thank those that have gone out there and gotten vaccinated, and those that haven't, really think about it. We're not forcing anyone, but look at all the statistics and from the right places, and look at the science behind it, and do the right thing.
Perfect. Thank you, Dr. Yeka. And again, if you're fully vaccinated, you can start to engage in more activities safely. It'll also help us slow the spread of COVID-19 in our community, and it'll protect yourself and those around you. So there's lots of benefits to being fully vaccinated. And now with summer approaching, there's going to be vacation plans, things that we'd want to do with other friends. So definitely get vaccinated so you can safely do all those things and take advantage of the summer. Perfect. And just a reminder, again, the Community Vaccination Center has new hours of operation. It'll be open on Sundays from 10 a.m. to 8 p.m. and Monday through Thursday from 10 a.m. to 6 p.m. In our yakimavaccines.org page, we'll have a lot of information on the Community Vaccination Center, as well as mobile units throughout our community. Again, those are free, easy, accessible, and open to anyone 12 years and older. Okay, I'm going to check to see if we have any last minute questions before we wrap up here. It looks like for the moment we don't have any questions, so that will conclude our update for tonight. Thank you, Dr. Yeka, again for your time and providing us all this information. And we'll be uploading this recording of this on our YouTube page as well for individuals who'd like to watch it and missed it this evening. Gracias a todos por acompañarnos. Nuestra actualización en español sería la próxima semana, el 29 de junio a las 6. Y alrighty, and thank you, Dr. Yaka, for your time this evening.
Good to be here.